Welcome to Conversations Live. For more than a decade, we've brought you the best in books, entertainment, celebrity interviews, and current events. When the movers and shakers of the world have something to say to you, they say it to us first. Here's your host, Cyrus Webb.
And welcome back, everyone, to Conversations Live. I'm your host, Cyrus Webb. Glad you all could join us once again, both for our radio audience here in Mississippi at WYAD 94.1 FM and WYADonline.com. We're glad that you all could be with us. Also, tuning in their online affiliates around the world, including our friends at iHeartRadio and Amazon Music Podcast. We're glad you all could join us today as well. This is part of our News You Can Use segment, and this is all about Medicare. Choosing a Medicare plan is one of the most important decisions a person can make, not only for their health and well-being, but also, of course, especially these days, for their wallet as well. Here to join us today to talk to us about some great tips about the best choices for each one of us, we're excited to welcome Dr. Philip Painter to our program. Dr. Painter is the Chief Medical Officer at UnitedHealthCare, Medicare and Retirement. We're going to talk to Dr. Painter not only about what you all need to know about the current enrollment season, but also, of course, where you all can get more information as well. Dr. Painter, thank you so much for the time. Really appreciate it.
Great. No, thanks for having me.
So I want to first of all talk about the enrollment period that's going on right now, Dr. Painter, for those who have not been keeping up with everything else that's going on. When does the current enrollment period end?
Yeah, well, we're kind of in the home stretch of that enrollment period. You know, it started October 15th, and it ends December 7th, so that time is coming up quickly. And you're exactly right. You know, why it's so important is this is the time that people have to look at their current coverage and make changes if they want, because that coverage is going to stay with them for the whole next year until the next enrollment period. And as you said, really important they choose the right plan for their health and well-being as well as their finances. So really encourage people to do a thorough review of their plan coverage.
So with that in mind, then, Dr. Painter, what tips do you have, or at least advice for our audience when it comes to either choosing a plan for the first time for those who are just now enrolling or for those who have a current plan?
Yeah, well, I mean, if they have a current plan, I would say one of the easiest things to do is look at your current plan and does it still meet your needs, because you can continue that plan. But just make sure you review it, because there are changes that happen each year to plans, and you may have had a change in your lifestyle, health, doctors that you see, and you want to make sure that that plan is still right for you and it has the coverage that you need. So I think that's probably the one way to make it really very easy.
Dr. Painter, to that point, on a personal level, we went through that with my mother this past year because of COVID, making sure that her plan included telehealth. And I think, you know, for a lot of our audience out there, when I discuss that with them, letting them know to make sure when they're looking at plans, make sure that's something that is available to them. In that same vein, let's talk about prescription drug coverage, because I think it's also one of those big things for people, especially when it comes to savings. What should our audience keep in mind, Dr. Painter, when it comes to their Medicare plan and how it deals with their prescription drug coverage?
Yeah, well, you're exactly right. I mean, the drug coverage is very important, and we say often, you know, the medications are people's first used and most used benefit, you know, that they have as part of their coverage. I think it's also important for people to understand that original Medicare doesn't cover prescription drugs, so that you need to have either a Part D plan or you can enroll in a Medicare Advantage plan that covers both medical and prescription drugs. And again, the important thing is, are your medications covered? So are they part of the plan? Are they part of their formulary? And then what's the cost of those medications? So are they in what's called an appropriate tier, where you may have no copay or cost share for those medications? So, for example, at UnitedHealthCare, we moved a lot of medications into what's called Tier 1, which means people have no copay or cost share for those. And then lastly, I would say, you know, look and see, do you have home delivery available? That's really a convenient way for people to get what's called their maintenance medications, and they can oftentimes get a 90-day supply of those medications at no additional cost. So those things are all important when you're looking at your drug plan. And then, is your pharmacy in the network? So if you have a certain pharmacy or pharmacist that you use and make sure that that's included in the drug plan network as well.
A lot of great information, a lot of things for our audience to keep in mind before this enrollment period ends, and we're glad to have you with us to kind of walk us through it. Again, everyone, Dr. Philip Painter has been our guest. He's the Chief Medical Officer at UnitedHealthCare, Medicare and Retirement, reminding you all about the current Medicare enrollment period, but also the things you should be able to think about when it comes to your current plan. Dr. Painter, where can our audience go for more information about this year's annual enrollment?
Sure. Great site to go to, UHCMedicareHealthPlans.com. A lot of information there about plans and choices, allow you to compare and do some shopping. So.
All right. Well, Dr. Painter, thank you again for being with us. Really appreciate the time and looking forward to speaking with you again.
Great. Well, thank you very much.
Hey, glad to have you, and we appreciate our audience for tuning in to another great segment of Conversations Live, part of our News You Can Use segment here at WYAD 94.1 FM and WYADonline.com. Until next time, I'm your host, Cyrus Webb, saying as always, enjoy your day, enjoy your life, enjoy your world. Thank you all for choosing Conversations Live. Now let's go make today amazing. Take care.